All right, and here we go.
Hello, I'm Dr Edward Bassignthewaite, and I'm here with Stephanie today, who is the holistic grooming company, yeah?
Yeah,
And we're going to have a conversation about silent pain, and probably talk a little bit about anxiety too, because I think that's another really important thing when it comes to working with dogs and grooming dogs and cats. So you've got some questions for me.
Yes, I do. I have a lot of questions for you, Edward, honestly. So you're going to have to tell me to shut up eventually. So yeah, there's obviously lots and lots of groomers work very much kind of close up with dogs, and we're wanting to obviously learn more about silent pain and how to identify what you classes like soft tissue pain and things like that. So we've got quite a lot of questions that some of our students have submitted in. So the first one was, based on your experience thus far, how common would you say silent pain is, and what do you think is a leading cause of it?
I would say that every second I get my hands on has significant soft tissue pain. So silent pain is nearly always chronic pain. You can have a legacy of silent pain over from an acute thing like an injury or a surgery that can kind of develop quite suddenly, but that's kind of a bit rarer. So it's chronic soft tissue pain or neck and back pain that's soft tissue related, and particularly, as I said, it's soft tissue pain, which is a bit tricky because it doesn't show up on x-rays, MRIs, CTs, ultrasounds, and most vets really don't know what it is or how to find it, unfortunately.
Yeah, and I think that's really important as well, because a lot of the time when we as groomers, if we suspect pain based on what we're seeing from like body language and behaviour, when we refer on to vets, we often get vets coming back to say there's nothing wrong with the dog, we can carry on doing what we're doing. And obviously then we've hit a brick wall. So how do we overcome that then with dog parents, or maybe taking the advice of their vets, obviously unbeknownst to them that there is such a thing as silent pain?
Well, the only way that you can really effectively and consistently discover this hidden pain in the body is to feel into the body, to palpate into the body, to bring connection and pressure into the painful areas, and then the animals will show you in their body language where they're painful and how much it hurts. Even then, often the response is quite small. One of the things that I've discovered with silent pain is that if there are any signs, and there are some red flags of silent pain that some animals will show, some animals don't show any red flags at all, and the only way you find is hands-on. But it's often the signs are very small compared to how much pain there is in the body. And animals are terribly good at compensating because it's chronic and it builds up slowly over time. They just learn to live with it, so they don't necessarily tell you anything. I think another problem is that humans expect their animals to make a noise when they have pain, to vocalize, and animals hardly ever vocalize pain. They hardly ever tell you that they have pain with their voice. So, and humans, just because we can tell people where it hurts and how much it hurts with our voice, there's this kind of expectation from humans that their animals will behave in the same way, and they just don't.
Yeah, that's really interesting. So it's more to do with your kind of getting savvy on body language and behaviour cues as opposed to hearing anything audio-wise. So she's looking at my face.
Body language and behaviour cues are helpful for sure. But what you really need to do is to be bringing pressure into the body, touch into the painful, that kind of thing, because behaviour and cues, while they're important, often people don't see the little changes in behaviour because they're so small that people don't think they're important. Or, for instance, one important one is if the dog stops jumping on the couch, a lot of people just think, oh, my dog doesn't want to jump on the couch anymore. But really what's happening there is that the animal's in pain. nearly every animal I've ever got my hands on that stopped jumping on the couch or jumping in the car or whatever, they've got lower back pain. It's stopping them from doing that. It's not that they don't want to, because every dog in the world wants to be on the couch, right?
No, that's true. I know that is absolutely true. So when you're talking about obviously touch base and feeling the pressure, is that what you do then with your whole energy body balance? Is that all about teaching people how to identify it that way?
Yeah, well, a core part of what we teach in the whole energy body balance programs is an assessment process where you feel throughout the body, reading the animal's responses and mapping out where there is neck pain, back pain, soft tissue pain throughout the body. And it's not that hard to do once you know how. It's a bit like riding a bicycle. If you've never learned how to ride a bicycle, it's terribly difficult until you learn how. But once you learn how, it's all nice and easy and lovely.
It's interesting you mentioned neck pain as well, because one of the questions, actually, I'll find it because I've got them all written down here, but it's to do with neck pain. And basically it was to do with, obviously, groomers. I'm not sure if you understand the process of grooming and how we work, or how we typically tend to work. We don't work conventionally, but certainly in conventional grooming, they use neck straps or neck nooses as a way to kind of physically restrain the dog. So would you say that one of the kind of significant factors maybe for a groomer in terms of silent pain is this neck noose and the pressure maybe put on the neck at this point?
Well, I suppose it depends on how that animal's been taught to accept that. If you've got an animal that you've taken time to teach to be comfortable and soft and to yield to that pressure and not to be fighting it and putting undue pressure on the tissues and structures in the neck, then it'll probably be okay. But at the same time, whole energy body balance is not just body work. We teach a lot about behavior and training and boundaries and how to communicate with the animals and how to read the animal's communication, and how to end what I call empathic bridging with the animal, so that you start to literally feel what the animal's feeling in your own consciousness at some point when you do this work. So, often when I get my hands on animals, I get sadness or fear or trauma come up in my body that is the animals that's going on around the system.
Feeding their energy.
Yeah. So, humans in general are really, really bad at a couple of things with dogs. And one is boundaries. Most humans just let the dogs come into their personal space, out of their personal space whenever they like. They don't have any kind of, I have personal space. If you ever see a group of dogs that are well socialized dogs, of course, you'll see that they all have a sense of personal space, and the other dogs respect that and ask to go in and out of personal space. But humans tend to just have this kind of open house, which isn't very good for the dogs in a lot of ways. It leads to anxiety and uncertainty and stress for the dogs not to have a nice, clear edge. Personal space and communication and about that. Another thing that we teach a lot about in the web programs is teaching the animal to yield to pressure, because when you're doing body work, you have to be able to position the animal and ask the animal to move here, have them in a position that's safe for you to work with them, and then be able to ask them to adjust their body so you can work with different places. So another key thing that we talk a lot about and teach a lot about is teaching animals how to yield to pressure, so that they don't ever pull in the lead, so that you can use a light touch on the lead and they'll be responsive to that without, most dogs that I see out in the street, they are really pulling and towing their humans around. 90% of dogs I see on lead are pulling on the lead. So that's another thing that I think is incredibly important, and it would be absolutely important in the grooming world too, is to be able to have an animal that you can talk to with pressure and ask them to move here, ask them to move there, ask them to give you forward and work with their foot without it being a fight. And the whole energy body balance method really helps that side of things as well, so that you can have more tools when it comes to communicating with animals. It's very much a relationship first modality, in that our relationship with the animal is the most important thing at all times, and respecting how the animal's feeling. You know, you talked about permission-based touch and all that sort of thing. That gets a bit tricky when you got sore bits, because a lot of animals will just say, well, no, I don't want you to touch my sore bits ever. And then you have to have a conversation around some gentle persistence and saying, well, come on, let's just touch it a little bit and see how you go. And then let's touch a little bit more. And you have to teach the animals how to...
Building up resilience almost.
Beg your pardon?
It's kind of almost like you're building up their resilience to being touched.
Yeah, you're teaching them how to accept touch, and you're teaching them how to accept healthy discomfort, which anytime you engage with pain and tension in the body, if you've ever had a massage yourself and you go to someone who's really good, it'll be like, oh, that hurts, man, it feels good.
But it's good at the same, yes,
But it takes a little while for the dogs to learn that, you know, often when I first get my hands on a dog, they go, you don't know how to pet a dog, you silly human. You know, there's this real vibe from them, what are you doing? You don't know, you're not giving me the right kind of pats. And often the first treatment or session I do with animals, they're quite like, oh, I don't know, I don't like it. But nearly always by the second or third treatment, they've worked out that that they feel better afterwards.
Yeah.
And, you know, I have a number of dogs that when they turn into our street, they get all excited because they know they're coming to body work, and that happens pretty quickly. You know, I remember a little dog I saw last year, the second visit, he dragged his human in and she said, oh no, what's going on? He never pulls on the lead. But at first he thought, I'm not sure about this. So they learned pretty quickly that
you're trying to help.
That they feel better afterwards, right?
That was another question somebody had asked, was how quickly do you see a positive difference to the animals that you're treating through your approach? It just depends.
It depends, but generally you'll see good changes relatively quickly, at least some good changes. Sometimes you'll get dramatic changes pretty quickly. You know, I had a greyhound that I saw years ago, Benny, who was 12 years old, retired racing dog, had a long career and won lots of money on the track. And his people called me in because they had a thunder phobia, but when I got my hands on him, I found that he was one of the most painful dogs I've ever touched.
Yeah.
And he was just a grumpy old man. He spent most of his life on his bed, would grumble at everyone if they watched TV past 8 o'clock at night.
That's like me, usually.
But we did a series of bodywork treatments with him a week apart, 4 treatments a week apart.
Right, okay.
Came back for the second treatment, there'd been a small improvement. Came back for the third treatment, there'd been a small improvement. But when I came back for the 4th treatment, there'd been a dramatic change. There was a whole lot of new behaviours they'd never seen before. He started stealing soft fluffy toys from their daughter's bed to snuggle up with at night. He started showing interest with and playing with toys for the first time ever. At night, instead of complaining about watching TV, he was up on his feet going around asking for touch and connection. He did zoomies for the first time in years, and he became the world's largest puppy at the age of 12. He started getting in the bins and tearing things up and doing all these kind of puppy things that obviously he had so much pain and trauma that was just like a cage around him. And you know, I've had other animals that it might take more or less sessions to get a real shift, that you can see a real obvious shift. But nearly always you see changes pretty quickly. You get dogs that are happier, more playful, more engaged, more relaxed. And maybe it'd be good to talk a little bit about anxiety here, because I know a lot of dogs have anxiety around going to the groomer, because a lot of groomers are not necessarily as kind and lovely as all of your community are.
Yeah, it is such a high stress environment for so many different reasons, I think. And I think as well with dog parents, they almost expect that a dog is meant to not enjoy the groomers. But I do think that there is a strong link between emotional trauma and uncooperation in the groom room as well. And I think that a lot of emotional trauma can be trapped in the body and cause silent pain. So it's all kind of interlinked.
Yeah, whenever you've got physical silent pain, there's always an emotional component and a mental component and an energetic component. So, you know, your animal is not just a physical being. The animals you're working with, they're an emotional being, they're a thinking, processing being, and they have this whole, and all the energy systems as well. So absolutely, you know, if you've got a physical injury, maybe most of that legacy will be physical pain, but there's the emotional shock and trauma as well. If the animal loses one of their other animals in the family that they've been living with most of their life, then, you know, there'll be a greater emotional component, but that affects the physical body too. It's not, you can't just cut out sections of the animal. They're a whole, they're a whole being. And anxiety is a big problem worldwide, particularly in dogs. You know, the levels of anxiety are very, very high. There's a bit of a similarity with anxiety in that a lot of people don't recognize the early signs. They don't think they're important. Oh, the dog's just a bit crazy. We won't worry about that. And then, you know, sometime down the track, it keeps getting worse and worse. And suddenly you've got a major problem and needing medication, and it's a real issue. So when I started off hands-on work some 26 odd years ago, I suppose, 26, 27 years ago, I really focused on the neck and the spine initially, because that's what I had a mentor that I met who worked with horses' necks, and I thought, well, what about dogs and cats? They got necks. And as soon as I started looking for, you know, feeling with more curiosity into the neck and spine, I started finding a whole lot of pain, tension, restriction that before I went looking for it, and I didn't know it was there. Then over the years, I started realizing, well, you know, there's all these other soft tissues throughout the body, so we've got to be working with not just the spine, even though the spine is probably the most important part of the body to work with when it comes to this, because it, you know, it's the information, the highway for the body. But then I started noticing that certain qualities of touch cause the animal to relax at a body level. And as I played with that more and more, then I found that you can use relaxing touch if you know the right qualities of touch that cause this body level relaxation. It's kind of strange when you first start doing this with an anxious animal, because their body will relax and then they're like, oh my God, I can relax my mind. I like it. And when you've got an animal with chronic anxiety or chronic trauma, to relax at first can feel very strange, very unsafe for that animal. Almost stressful in a weird way to be relaxed. But I just found that if you do consistent relaxing touch with animals, and again, at first, often they're like, I don't like this, I don't want it, leave me alone. But if you gently teach them how to accept it and then keep doing this work, well, you nearly always get really big improvements in anxiety. And I'm not working in a vet hospital now, I'm working for myself, but in the last couple of years, I was working in a vet hospital, and I'd often do just a little bit of relaxing touch with animals that come in the morning for surgery, and it would change the colour of their day. You'd see them go from like, I'm freaking out, and here to, oh, I can relax in here and be relatively calm. So it's another thing that you can absolutely integrate into grooming practice and clinics. But not only that, you know, what do you charge for a groom?
It depends. So I charge on an hourly basis. So
what do you charge per hour?
£60, Great British pounds, £60 per hour I charge, but it varies for all groomers. It just depends on what they charge. But yeah, so £60 per hour.
Well, you know, the other thing is that having bodywork credentials means that you can value add to your business. Every animal that comes in your door, you do a free assessment, and if you find pain, you show the people the animal with the pain, and you say, well, you know, would you like to, in addition to the groom, have a bodywork session, and maybe for half an hour session you charge £45 or something like that. So you can increase your profitability while making a
Yeah,
beautiful
okay.
difference to the animals, and you can also integrate the principles of yielding to pressure and more refined communication and understanding, deeper connection, and relaxing touch into the whole grooming process, so that you can take your holistic grooming and to another level in terms of being able
Yeah.
to connect with animals more quickly, to help them learn how to accept the grooming process more easily and quickly.
Because
And
ultimately what you want, yeah.
yeah,
So would you recommend doing some of that relaxation techniques for every individual sessions just before you groom? Just take part in a 10-15 minute session and then carry out your grooming tasks after, or would it be completely separate?
it depends a little bit, I suppose. It would depend on your practice and how you got things set up. But when I'm like, I had a little dog that I saw this week that came in for a checkup, and he's an older dog. He's a little Jack Russell type dog, and totally deeply connected with his human. And you know, other humans don't exist and don't touch me. And so when I first got him on my knee, he was like, let me go back to my human. But what I did was I just did relaxing touch with him for a little while before I examined him, and helped him settle and relax and soften. So there's a whole lot of ways that you can apply these kinds of techniques and skills while you're working in your grooming practice or your grooming clinic. And it would depend on the animal. You know, if you had let's say a 9-month-old Legato, and the Legatos here in Australia are feral, their temperament is vile, and their coat is like a sheep's, and it mats as soon as it gets about 3 millimeters long. So these dogs, and they also have so much hair in their ears that you can knit a beanie from each ear, sort of thing. You know, they're genetically challenged and temperamentally genetically challenged.
I've never had one, thankfully.
No, but if you had a 9-month-old Legato that's come in that, and I say this because I had one come in that came to me, was stealing the grandchild's toys, and the husband had reached under the bed to try and get the toy back, and had bitten the husband on the thumb, and you know, puncture went right through the thumb. When it came into me, he was like, "Yep, I'll bite you. Absolutely, I'll bite you." And he had mats all over his head and ears, but the groomer couldn't touch him, right? So I started off with the whole on the lead, yielding to pressure, getting some movement and that sort of thing. I started off with touch with the end of the lead, because with these dogs that are you know, fearful, and he was a very strong-willed, you know, that hadn't had clear boundaries and hadn't had the right training, all that sort of thing. So, you know, I've got the lead out the front running across the face so that there's a little barrier that he can't bring his head around without going through the lead first, and started touching with the other end of the lead. He's, "Oh, don't touch me." But pretty quickly you can usually transition from some kind of wand that's non-threatening to them. You know, some dogs you can't use the end of the lead because they've been abused with something like that. You might have to, I've used a wooden spoon for little fluffy dogs when I'm doing home visits sometimes, because I know they'll bite me, and if they bite the spoon, it doesn't hurt me. But pretty quickly, I got to touch him, and we did relaxing touch, and then we started to engage, and you know, some boundaries, like, no, out of my personal space. On the second visit, I got the clippers out, and I clip it. We got the mats off his head and ears. So you can really accelerate your ability to help difficult dogs with this kind of work. It's something that I'm calling, it's only kind of come to me just recently, but you know, you get natural horsemanship type things. Well, a lot of what we teach in whole energy body balance is what I call empathic dogmanship.
Right.
So there's a really big component of training, connection, communication that you need to be able to have if you're going to then engage with touch that is engaging with discomfort and trauma and anxiety. You've got to have this foundation of connection, communication, respect, boundaries, yielding to pressure, all these things. And, you know, there's still some dogs that I would put a muzzle on before I work with them hands-on, but that's pretty rare these days.
Yeah,
Does
that's
that make
really
sense?
interesting. That is really interesting. So how do groomers go about learning whole energy body balance?
Well, we've been talking primarily about the bodywork side of things just now. We've got two practitioner level programs. People who are grooming and in practice would want to do the professional certification, because then you can, you know, make it another big, beautiful thing in your business. That you can help dogs in a deeper way and go beyond grooming to setting them free from these prisons of pain and trauma and anxiety that a lot of these dogs have. So we have the Web Bodywork for Pets practitioner program. That's a very hands-on one. That's where you learn. I mean, we have a core practice for the human, which is an internal practice to get you very present and connected and filling your energy cup to overflowing, so that you can work all day long and, you know, you'll be tired at the end of the day, but not depleted and drained, which a lot of people are with working in a lot of people, particularly who are drawn to the more holistic side of things, are very empathic, but they just empty their cup into the world.
That is it, they're burnt out, aren't they?
And then there's an assessment process that you learn, and we have a really broad range of different kinds of touch skills. There's more than 25 different skills. You learn the individual skills quite quickly, and then you grow into mastering them for the rest of your life.
So how long does it take to actually go through the process? I know it's obviously a lifelong kind of commitment to it, but...
Well, to complete the certification, if you can commit consistently 2 to 4 hours a week, you should get through the certification in 3 to 6 months.
Yeah. Do you have many groomers on your program right now?
We have a few,
Yeah.
People who are groomers in the program. Then we have a second program, which is Web Energy Work for Animals, which is intuitive development and energy healing for animals. So that's a whole other dimension to how you can connect with, understand and sense and feel what's going on in the animal's energy systems and consciousness, and use more energy healing based skills. And now I always use them like they're like two peas in a pod, really.
Yeah, precisely.
So they're deeply complementary, and whenever I'm working with animals, I'm always using both in parallel.
Is there a preferred way of doing it, one after the other, or does it matter which one you would do first?
It depends. I think another thing to tell you about the whole energy body balance method is that it is very, very how you apply it. I mean, we learn the skills in a structured way. We have to learn the skills in a structured way to learn them initially. But we teach you how to put it into practice in a very flexible, intuitive, adaptive, experimental type way. So you're always responding to the animal's communication and adjusting and adapting what you're doing. So, you know, when I'm working with a dog, for instance, I might be doing energy work then body work. I might be doing a combination of the two together. It just depends on the circumstances and situations, and you never do the same treatment even with the same animal twice, because every time an animal comes to you, they're different. Their bodies change. They have different needs, and a lot of modalities out there give you kind of like a very structured thing where you do this skill with that part of the body with every animal. And while you can get good results with that, I don't think you can get truly spectacular results consistently with that. You know, you might get spectacular results with some animals that particular combination works better for them than others. But I really believe that, you know, it's like grooming a dog. You're not going to, you're going to meet them differently every time they come through the door, because they're different when they're a puppy than when they're 2 years old. And when they're older, you might need to take more time because they're stiffer and more painful or whatever, you know.
That's interesting. You tapped into that, because that's another of the questions. It's to do with, is there a specific breed or age where you find that silent pain or soft tissue pain is at its peak?
Well, what happens is that soft tissue pain is inevitable. You know, just the wear and tear of everyday life, play, walk, slowly adds little bits of layers of soft tissue pain in the body over time. If you've got a dog that's a really high impact dog doing agility or got a ball addiction or whatever, then that accelerates a lot, because whenever you get an animal that gets excited, their arousal levels shoot up, their pain tolerance shoots up, and they don't necessarily feel what they're doing to their body until they stop. And then you might have an animal that, I think another real hallmark of silent pain is that you often don't know just how much silent pain has been limiting an animal's life until after you relieve it. And suddenly they come out of their shell and they're more active and they're more playful and they're more happy and they're more engaged. And, you know, I've got a lot of people that said to me, wow, my dog's just a couch potato. They just don't like doing much. They sit around. And I work with them and suddenly they're like, whoa, I'm feeling good. I want to play. I want to have fun with you. So, I would say that there is, even in young animals, there is a risk that they can have silent pain. I had a 16-week-old Rhodesian Ridgeback puppy that came to me, when was it? Oh, a couple of years ago now, that at 16 weeks of age was displaying obvious behavioural problems, potentially aggressive. And, you know, when I first met this dog, I'm going, whoa, gotta be careful with you because you might bite me. Well, when I got my hands on this little, well, he wasn't little at 16 weeks, he was huge.
Dog.
He was massive. But he had severe whole body soft tissue pain at the age of 16 weeks. So you can't just say, oh, because I got a young dog and they seem fine, there's nothing wrong. You don't know. You know, the reason that I really woke up to how easy silent pain is to miss is that I missed really awful neck pain in Mitzi, my own little dog, for 3 weeks. Now, I went off, took him to be my demonstration dog at a weekend clinic training for the whole energy body balance work. He was just a little bit more reactive to other dogs coming near to him than usual. It wasn't a big change, it was a little thing. That night when I got home, I got my hands on him. As soon as I felt in the top of his neck, he went, whoa, I'm in agony. Well, it turns out that Mitzi had fallen on the steps 3 weeks before that, and I was married at the time. My wife had seen it happen. And as she said, he just got up, shook himself up and seemed okay. So she didn't think to tell me, right? Yeah. So, you know, that woke me up to the fact that a really experienced veterinarian whose passionate special interest is neck, back and soft tissue pain, if you don't get your hands on the animal, you're going to miss it. And I got to tell you, I still miss silent pain in all my animals regularly, but I don't miss it for long because I check them regularly, you know? And that's another secret. It's not just for your clients' pets, it's for your pets that this work is probably more important than anything, is that you learn how to do this so that you can make sure your own animals are not suffering in silence.
I've got 3 dogs now. I've lost 2 the last 2 years. It's been heartbreaking, but I would say that each of my dogs at home could benefit from web 100%. Yeah,
and you know, percentages, at least 50% of the animals that I assess have undiagnosed soft tissue pain. Yeah. I reckon dogs up to 2, maybe you've got a 10% kind of risk factor. Okay. Dogs from 3 to 5, maybe you're getting up to 30-40% risk factor. But once you get over 7 years of age, wow, you're probably getting 70% plus. And by the time you get to older animals, you can pretty much guarantee that they're going to have soft tissue pain. You know, every animal that I've ever met, older animal, has got soft tissue pain, and they really benefit from having the body work. What other things can you do perhaps to complement what you do then as well to make dogs more comfortable as you work with them? as in during a session.
Like just for in between sessions, like how can you like further support them with their recovery or with their maintenance? I suppose you're not ever going to get rid of silent pain completely, but is there other things we can maybe think about or?
Yeah, well, I suppose minimising high impact, high arousal activity in play.
Okay.
I see some people on the beach that have got their ball thrower and they will throw that ball for the dog for 45 minutes and the dog is just so far over threshold it's not funny. So, you know, that is something that causes, you know, it's a problem.
Here, I suppose.
It causes a major pain and injury over time and they will always want to play with the ball no matter how painful it is. There's another confusion for people, you know.
Yeah,
For people. So yeah, it's a real big problem, and what I don't know how I've been lucky enough to discover all this, just probably because I'm obsessed with it, and I've had some lucky circumstances in terms of mentors and things like that have led me down this path. But what I've realised is that there is just a massive knowledge and skill gap across the board in the whole world when it comes to our domestic pets and dogs.
Yeah.
Owners, guardians, professionals, vet nurses, veterinarians across the board. There is little knowledge that soft tissue pain, chronic silent tissue pain is a thing, and even less knowledge about how to effectively find it and treat it. The only way that you can really effectively treat it is through engagement with touch. It's the only way that you can release these patterns of pain and tension out of the tissues of the body. You give pain relief drugs for them, make the animal feel better, but the problem is still locked up in the body. You haven't released.
Celebrating. There's fireworks going off behind you.
Yeah.
Did you see that?
No?
No. Oh, there was like fireworks going off behind your head.
Oh, that's Zoom just being weird.
No.
Zoom does these weird things now and then where I don't know.
So, Edward, so when you're treating patients as well, do you advise that they do that alongside a pain med try, or would you say stay away from that, or does it depend on how severe the case is?
Look, it depends.
Yeah.
Absolutely. Pain relief can be an important part of this, particularly with older animals. I saw a little old Sheltie this week who we thought we might have to put to sleep because he had some stuff really painful and had trouble getting up and weak and wobbly in the back legs and all that sort of thing. A pain medication that I use is when it comes to pain, you know, you've got to remember that a lot of these older animals not only have soft tissue pain, they have arthritic pain. And there's a whole range of things that you can do to help older animals with arthritic issues as they age, starting off with nutraceuticals like streamless muscle extract, brachyt vital, things like that. Then I tend to use a lot of CBD, cannabis extracts as medication for pain relief, for anxiety, for epilepsy, for just about everything.
Do you feel that that's effective as well, CBD oil? Do you see that there's an actual positive impact on CBD as well?
Oh, like it. Yeah, it's strong pain relief. It's great for anxiety. It's great for autoimmune and IBD and all sorts of different things. It's a very safe, highly effective herbal medicine that is probably the core kind of medicine that I prescribe in my practice with a range of different things.
Yeah.
But at some point with older animals, the more kind of nutraceutical approach is enough. And you need to think about palliation. But then you do need to go to a vet, and they're probably going to prescribe non-steroidal anti-inflammatories to begin with, something like meloxicam or Galliprant or one of those other medicines.
Yeah.
Maybe you start off with only using that on bad days, and then at some point it's like, well, you know, we need to put them on daily in addition to all the other things. There's the cartrophin injections. There's gabapentin, and then there is Panadol that you can use as well, and some of the older animals I get will be on all of these things, and maybe on monthly ketamine injections as well, because that's another thing that affects pain pathways in a good way. Now, that being said, I know for sure that you get much better outcomes if you're doing body work as part of the maintenance for these older animals. I do get some older animals that come in to see me. You know, a good maintenance interval for a young dog might be 4 to 6 weeks. When you get an old painful dog, you know, at least 4 weeks, and sometimes you're going to 2 weeks, maybe even weekly with really old dogs that need a lot of support. And that maintenance just keeps the body moving. You know, it relieves soft tissue pain to the extent that you can with an older animal. You can't completely relieve it with a really old animal that's got a whole lot of stuff going on in their body. But therapeutic touch makes an incredible difference for older animals. It keeps them mobile. The other thing about therapeutic touch is that it prevents soft tissue pain over time. Consistent body work from a young age means that instead of this, you know, a normal dog that doesn't get body work builds up and builds up and builds up. Well, you get a dog that's doing body work, builds up a little bit, you have body work. Builds up a little bit, and you have body work, and it still does build up over time, but the rate of it building up is much slower, and you get, when they get to old age, they're going to be a lot more comfortable than if they haven't had consistent body work.
And I'd imagine as well that would be a really good opportunity to bond with your pet at home, but also build up that kind of positive association with touch early on.
Absolutely.
As well. Yeah.
And there are a couple of skills that practitioners can teach their clients, but use at home in between. There's a couple of the relaxing touch type skills that we encourage all our practitioners to teach all the people that bring their animals in, and then practice it in between. And that's great for anxiety, and it also at least releases some of the more superficial kind of ways of silent pain and tension, and it gets the animal used to that kind of touch.
Yeah.
So that then you can go deeper with them when they come in for a clinical session.
Yeah. Would you say that there's a kind of minimum age you would start that, or is it just
at first, really?
Yeah.
Because you know, if you get puppies and you do this kind of touch work with puppies from a really early age, well, it's developmentally fantastic for them. And then, you know, when they get to 8 or 9 weeks and they go to the vet can open their mouth and do all these things that normally puppies don't touch me. So there's all that kind of thing too, and you said too that there are definitely benefits for the human. Whenever you have extended periods of touch with your animal, both you and the animal have a whole lot of oxytocin release, which is the bonding hormone, the relationship hormone. It causes relaxation, and humans get benefits because when you do relaxing touch or therapeutic touch with your animals, then your whole system comes into sympathy with the animal, and you relax too.
How did you, because obviously you've came from a conventional background as a vet, haven't you? And then you've kind of converted or kind of over to the holistic side. What was the motivation for you changing?
Well, I got chronic fatigue, and what I didn't know was Lyme disease. And Western medicine was great for a couple of things, a couple of symptoms, you know, and then it's like, well, we've got syndrome. That means we don't know what's going on, and we don't know how to help you. So there was really, the only thing I found that gave me, or the thing that I found that gave me the most symptomatic relief was energy healing, and I also explored diet. And once I started noticing that these things made a difference for me, I started trying them with animals, and I noticed that animals responded really well. And then I started learning more about, you know, the fact that vaccinations last for 5 to 7 years, and you can teeter test, and there's all these other kinds of things of herbal medicine, homeopathy, and energy healing and body work. Yeah. And the more that I did that, the more I found that animals responded really beautifully to it. So, you know, I came to it through health challenges really of my own.
It's really interesting. So as, obviously as a pet professional and as a conventional turned holistic vet, how would you approach other vets when trying to kind of plant the seed about silent pain?
I don't really know the answer to that.
No, it's really hard, isn't it?
It's a tricky one because vets are, a lot of vets are very, very trapped by their education. And I think another reason that vets can't really get this whole thing about silent pain is that I look at the X-ray and the animal's fine. There's nothing there to see.
Yeah.
And they've never been taught how to feel for it. They've never had any education about it at university. And I you know, a couple of years ago, I had a few final year vet students come through the hospital I was working at, and I'm telling them about all this stuff, and wow, it's fascinating. Never heard a thing about it. They're about to go into practice. So I know that there's still this big thing that people just don't know it's there, and animals all over the place are suffering with silent pain, and humans are too, to be honest. You know, it's not just, and horses, and it's not just our pets. So I just keep doing my thing and hoping that people will listen. I suppose I've got a book coming out pretty soon about this as well. And hopefully, you know, that'll spread the word further, and sooner or later we'll hit a tipping point, and suddenly it'll become an industry-wide, worldwide thing where people wake up to it.
So when's your book coming out? Because that's really exciting.
Sometime in the next couple of months.
Oh,
date just yet, but yeah, that's pretty exciting.
And it's all about silent pain and soft tissue and.
Yeah, it's what's the title of it?
Oh, that's really exciting, honestly.
The title is Heal Silent Pain, Trauma and Anxiety in Pets. I'll find and heal your pet's silent pain is the title. The tagline is learn to hear your pet's silent cries for help. Never again miss hidden pain, anxiety and trauma. So will
that also be available worldwide, so via Amazon, Barnes and Noble, all of those different places?
It'll definitely be on Amazon. And we will let you know when we launch it too. Maybe we can get together with your community and have a chat about it all.
It'll be amazing, honestly, and I'll add that to our recommended readings list as well for students to obviously buy and kind of study. I'm sure we've got loads of different, is there anything else we have? Anyone's trying to read these all to make sure I'm not missing anybody's.
You've got questions from all your crew, hey?
Yeah, yeah, and I'm worried in case I forget ones, and so I write them all down before I come on. I think we've kind of covered this one anyway. How common is muscular pain, and with it being difficult to see via X-ray, what is the best way, to tell if your dog is suffering from muscular pain? But again, touch, isn't it? It's like you said.
Well, I really talk more about soft tissue pain than muscular pain.
Yeah. Is that different then?
Well, muscles are part of the soft tissues for the body.
Yeah.
But then you have all the connective tissues as well.
Ah, yes.
And what I call the neurofascial network. Now
is that the kind of web-like stuff inside the body that connects everything together?
Yes. Yeah, that's right. And it's a really interesting thing that I call it the neurofascial network because the fascia's got so much nervous tissue in it that functionally you can't separate them. It's more than 60% of your animal sensory awareness comes from the fascia.
Oh my goodness.
So it's it's like an extension of the nervous system. The nervous system reaches out through all the connective tissue, which is embedded in all the soft tissue, gives everything. It is the structure and form and scaffolding of everything in the body. It also interconnects everything in the body. And that's what I'm talking about really when I talk about soft tissue, is this neurofascial web or network throughout the body. So yes, you can focus in on muscles, and there can be pain in the muscles, but if there's pain in the muscles, then there's pain in the neurofascial network, because the neurofascial network is embedded on all cellular dimension throughout the muscles as well. So the way that, one of the things with whole energy body balance is we don't teach a whole lot of anatomy and physiology.
Okay.
We teach you instead how to get your hands on the animal, to feel what's going on, and to make a difference with touch. Because in a way, it's just not necessary for you to know all the ins and outs of which muscle goes where and stuff like that to be highly effective and make a really big therapeutic impact with animals.
Yeah.
Of course, if you're the kind of person who wants to know all those details, you can go off and learn them, and that can help you help animals.
Yeah.
You know, in perhaps a deeper way as well. So I'm not anti that, but you know, the other things I'm really just want to. I want to get people making a difference for animals as much as they can, as quickly as they can, and we found really that anatomy, you need some basic kind of understanding of it, but really you want to be
It's not
going
really that important.
for feel and connection and listening to the animal so that you can respond to them.
That's amazing. Just one last question, because I know obviously you've only got 5 minutes left with me. I don't want to eat up any more of your time, but do you work with the feet at all, as in the paws?
Sometimes, yeah.
Would you say there's quite a lot of significance to the feet in terms of pain, or do you think it's just the same as?
It depends on the animal. I mean, in some
Again,
animals,
it just depends,
absolutely,
yeah.
that'll be true. In other animals, not so much. Certainly, working with the feet is helpful just to help animals accept being touched. You know, one of the big things that I think is really important is that every animal, you should be able to handle them in a relaxed, comfortable way all over their body with the animal feeling okay about it. And a lot of people just don't like their feet being touched very much. I just put a link in the chat that you can give to people if anyone's interested in coming and training with us.
Oh no, me definitely, but I don't need a discovery call. I'll just sign up.
Okay, well, absolutely.
So will I just save that link and share that with everybody? Okay. And what's that for?
Just let me know that you come from the Holistic Grooming Academy, so that and you know we'll give you a bit of a discount.
Oh, thank you. I wasn't expecting that at all, but thank you very much.
Yeah. What the food called? Then we'll have a chat about how to get you started and how to get you out there and, you know, going beyond grooming.
Thank you so much.
This will not only expand your ability to groom dogs in a more different way, but it'll give you a whole other universe of possibility when it comes to helping animals, transforming their lives for better, relieving pain, relieving anxiety, healing trauma, and increasing your profitability, which is kind of important.
Which is even better. No, honestly, thank you. It was such a blessing to talk with you. And I can't believe you're in Australia as well. It's like past my bedtime. In Scotland, it's 10 o'clock here at night time. So I'm like, oh. But no, I couldn't wait to speak to you, Edward, and it's been an absolute pleasure to connect with you, and thank you so very much for your time.
You're welcome.
Thank you. We'll have a lovely day, and we'll catch up at some point, I hope